Hello everyone, welcome to sqadia.com. Today we are going to talk about the basic surgical skills. Surgeons are men of action, and men of action require a specific set of character and a specific set of skills. Their character helps them to build themselves, to learn knowledge, to gain the skills. And finally, the specific skill set is what makes a good surgeon. In this presentation, we'll talk about the specific skill set that is required for a surgeon to become a good physician as well as a good surgeon. We'll see what the skill set actually is. The lecture has been divided into 5 sections. In the first section, we'll talk about the patient positioning and safety. It is important to position the patient properly and to ensure that the patient is safe, since the patient would be unconscious during the procedure and you are responsible and liable for the safety of your patient. In the second section, we'll talk about skin incisions. Skin incisions are the openings that are made in the human body through which you enter the human body. You will see what are the different types of skin incision, how the skin incisions should be made, how deep should the skin incisions be, and what precautions should be taken before making these skin incisions. In the third section, we'll be talking about wound closure. Wound closure is a very important topic in surgery. We'll see how the wound closes itself. We'll see what primary closure, secondary closure, and tertiary closure is. We'll see in which type of wounds we perform a primary closure, in which type we go for a secondary closure, and in what type of wounds actually require a tertiary closure. In the fourth section, we'll be talking about the suture techniques. The technique of suturing goes back to the start of the surgical principles and is very important for the surgeon to understand. We'll see what are the various techniques that can be employed during suturing, what are the prerequisites, and how to perform an optimal suture. And finally, in the last section, we'll talk about the alternates to suturing. We'll see what are the various alternates, the developmental alternates, the developmental newbies in the field of surgery, and we'll see how they come and how they come into action. We'll see how they affect your patient, and we'll see the cost effectiveness of these procedures. I hope you're excited about today's lecture. For further such lectures, keep watching sqadia.com.